Welcome. I'm Dr. Lindsey Berkson, and tonight we've got a really great guest. We have David Brownstein, who is a family practice physician specializing in functional medicine, and he is really something else. In fact, I went and looked up the word prolific. And prolific is an adjective that stands for a number of things. One, it could be a plant, an animal, a person. We've got a family practice doc who's producing much fruit, much foliage, much products. It could be an author that's producing many works. So I want to give you a sense of the prolificness of the really great smart plus heart physician that we're lucky to have with us tonight. Dr. Brownstein wrote Iodine, Why You Need It. We're going to be talking tonight on the thyroid. He wrote Overcoming Thyroid Disorders by Dr. David Brownstein. He wrote Vitamin B12 by Dr. David Brownstein. He wrote Salt, Your Way to Health by Dr. David Brownstein. Drugs That Don't Work and Natural Therapies That Do by prolific Dr. David Brownstein. This is going to get a little monotonous, but I want you to understand this. The Miracle of Natural Hormones by Dr. David Brownstein. A Guide to a Dairy-Free Diet by Dr. David Brownstein. The Skinny on Fats. All women love that. I'm trying to get the scientist who has really made his whole life story archival estrogen and how estrogen first signaled on the planet. And she did it first with the help of a metabolite that's like testosterone, but it also needed a little fat. And he said, boy, every woman could relate to that fat helped a woman start to signal and speak on the planet. So The Skinny on Fats, The Guide to a Gluten-Free Diet by Dr. David Brownstein. A Guide to Healthy Living by Dr. David Brownstein. The Soy Deception, which we could probably put on our boxing gloves and have a good debate on that one, by Dr. David Brownstein. And Overcoming Arthritis by Dr. David Brownstein. So we are truly lucky to have him here for our bonus and to be talking with us about thyroid and why there's so much confusion about it and how to get unconfused about thyroid. So I know you're talking to me in Michigan. You live now on a gorgeous lake. I'm jealous as hell, but you keep inviting me and I'm going to show up with 8 suitcases. Welcome.
Anytime.
I think you need to talk a little closer to the mic.
Anytime, dear.
Okay, thank you. So tell us, how did you get on this path of really diagnosing and treating thyroid disease different than other doctors do, and why is this so important?
Well, I didn't start off on this path. I started off practicing basic family medicine as I was taught and trained at my conventional medical school. And my turning point became about 6 months into residency when I started to lose sleep for an unknown reason. And I was in the middle of I finished my residency. It was the first year of my practice. And I was in the middle of negotiating a buy-in for a partnership at the end of that year. And for an unknown reason, I stopped sleeping for a couple of nights and I got anxious. And I remember getting up and getting ready to go to work and telling my wife, Allison, I don't want to be a doctor anymore. And that was a shot out of the blue because all I wanted to do was be a doctor since I was a little kid. And I met her at the University of Michigan when we were 18 at my freshman orientation the first day. And
you are blessed. You walk above the clouds, my dear. I swear to God, that sounds so wonderful.
Since she's known me, every time I tell a woman that story, they're like, oh, that's so nice.
It is. It's so wonderful.
So since she's known me, that's all I wanted to do was be a doctor. And I wanted to be a family doctor, modeled after my family doctor. We came from a conventional household. We went to the doctor when we were sick. We took whatever they took. We didn't supplement in our house. So I am lacking some sleep. I don't know what's wrong. Allison says, what are you going to do? And I said, I don't know, but I can't do this for the next 30 or 40 years. And she said, why not? And I said, because I'm not helping anybody. I felt like I was prescribing drugs they didn't need. And I was prescribing more drugs to treat the side effects from the first drugs. And I just couldn't do it. I knew deep down this wasn't helping anybody, but I really hadn't any tools in my toolbox to change what I was taught. So around that time, a patient of mine had been bothering me to meet his chiropractor. Now, at that point in my medical career, I never referred to chiropractors. I never encouraged my patients to see them. I used to tell them, don't go see them because they were dangerous, even though I never knew what they did or never met one before. And in my anxiety state and my lack of sleep, I agreed to meet this chiropractor. And when I met him, him and I hit it off as a friendship right away. And he was a very smart doctor. His name was Robert Radke. He knew more functional biochemistry than I did. And, we spent a couple hours together, and he was, very interesting to me. He was treating people with vitamins, minerals, herbs, talking to me about chiropractic philosophy. And either he was lying to me, or there were other therapies out there I wasn't taught in medical school. And at that meeting, he brought a book with him, Healing with Nutrition by Jonathan Wright, an allopathic physician. And I took the book home, read the chapter in cardiovascular disease till late at night. And the reason I looked at that first was my father was very ill with heart disease. He had his first heart attack at 40, his second heart attack at 42. Over the intervening 20 years, he had numerous angioplasties and bypass surgeries, and was on 12 different medications for blood pressure and diabetes and hypertension. And more importantly, he looked like he was going to die at any moment at that time when I was losing my sleep and, not feeling well about what I was doing. And he had suffered from continual angina for 25 years, was popping nitros like they were candies. And we were all just waiting for the phone call when it finally happened to him. So I read that chapter in cardiovascular disease. I called my dad in the office the next day, and I drew 2 blood tests on him based on what I read in that chapter. I drew his thyroid levels, and I drew his testosterone level. And his thyroid levels came back in the reference range, but in the lower part of the reference range. And his testosterone levels were below detectable limits, almost close to 0. So I put him on natural desiccated thyroid hormone and natural testosterone based on what I'd read and that lab test. And within 7 days of doing that, his 25-year history of angina melted away and never returned. His face, which was pale and pasty looking, turns pink again. He was doing more. He was, not short of breath. And 30 days later, I check his blood work, and his cholesterol level, which was in the 300s, fell below 200 without changing any of his terrible dietary habits. And once I saw the changes in my dad, I knew that's what I wanted to do in medicine. So I went to the partners in the practice. I told them I need to leave. They said, "What are you going to do?" I said, "I'm going to go do holistic medicine." And they said, "How are you going to do that?" And I'm like, "I don't know, but I can't do it here." And, I left shortly thereafter. And so from that moment that I left them, I started checking every patient that walks in the door for their hormone levels, particularly their thyroid hormone level. And so we're going on 20 plus years, it's 23 years now. It's 25 years now that I've been doing this. And every new patient gets a thyroid hormone workup. They also get their other hormones like testosterone checked.
So what's your thyroid screening workup that you do that might be different than other doctors?
So that's how it started. So when I was taught in medical school, I was taught to screen people for thyroid problems by checking a TSH level. And if the TSH level was in the reference range, they do not have a thyroid problem. And if it's out of the reference range, they have a thyroid problem. I wasn't taught anything about any of the other testing for thyroid. So I now check TSH levels because I think it's an important test. I check free T4, free T3, which are the inactive and active thyroid hormone levels. I check reverse T3 because I feel you can't assess the other levels without reverse T3. And I check thyroid antibodies in every new patient that walks in the door. And I can get a better idea of how the thyroid's functioning and how to treat it based on those levels. And I don't know how anyone can properly assess or treat a thyroid if they're just checking a TSH. And now they check a TSH and a T4 level, and it's still inadequate.
So why is it that there is a growing group of doctors and smart patients that are aware of this? The patients usually were ill and they got better. In fact, I know when we were interviewing Dr. Alan Gaby, he calls it sub-laboratory thyroid disease because it doesn't show up in the lab. But yet there's still such endocrinologists that are the specialists that deal with thyroid don't agree with this. What is that? And how does patients are caught in the middle?
Well, number one, patients are more knowledgeable now than they were 25 years ago because of the internet. When they're not feeling well and the doctor says everything's fine, they're going to go look it up and see what their symptoms correlate to. And hypothyroid, the thyroid gland, which sits here in the lower part of the neck, produces a teaspoon of thyroid hormone. That teaspoon of thyroid hormone has, for a whole year, it's a teaspoon of thyroid hormone for a whole year, has to drive the metabolic rate of every cell in the body 24/7, 365 days of the year. So little variations in that teaspoon have big effects on the body. So when people are feeling tired and achy, they're gaining weight, their hair's falling out, they're puffy, they know something's wrong. If their doctor tells them everything's fine, they're going to look up their symptoms, and many times they'll come up with thyroid problems as part of, could be the cause of their symptoms, and then they will start searching. And so one of the reasons I wrote my book way back when was because I thought it would, number one, I write all my books for anybody to read, and I write my books for my patients to be educated on how I'm thinking, and I want them educated, because if they're educated, they're going to follow along, be more willing to follow along with me, and be more willing to walk the path with me. And so there's my book, there's Brodo Barnes' book. I mean, there's many books out there now written about this, and patients are just more aware. They're just smarter patients.
So when you run your thyroid antibodies, which are the antibodies that you run?
I run antithyroglobulin and TPO antibodies, thyroperoxidase antibodies, as part of my, every patient gets that as their new patient workup. And every year they get those same thyroid tests at least once a year.
Do you find that the TPO is the first one to elevate versus the other one?
The TPO seems to elevate a little more frequently than the thyroglobulin, but I don't think it matters that much to me which one's elevated or if they're both elevated. It's just the same problem, and I treat it the same way.
So when you treat people, and if you diagnose them as having Hashimoto's or autoimmune disease of the thyroid, do those levels go back to normal?
In 50% of the cases, they'll go back to normal. Usually these are younger people. And in the other 50%, I would say half of those levels will drop in half or more, but still be present in lower amounts. And the other 25% will either not budge or go down a little bit. But I don't get so caught up in what their antibody levels are if they're feeling good. And if they start off feeling lousy and all of a sudden they're feeling, their health is back, they're 100% better, I don't get so riled if they're still producing antibodies.
Okay, so it's basically how the patient feels. The reason I was asking that is that there's this really smart endocrinologist here in town, Dr. Blevin, who told me about 20 years ago I should just age gracefully because of I just kept losing more and more parts of myself, and I should just suck up and age gracefully. But everyone knows him, that he's a great guy, and he says you can never lower antibody levels. And I said, well, functional docs and nutritionally oriented practitioners do. And he said, I don't believe it. I want to see it. So I've actually gone in there and shown it. And then he said, well, what does this mean? It doesn't really mean anything. And I said, well, it does. It means that you're getting a result by effective care.
When I lecture to healthcare professionals, I have a whole lecture on this and a whole lecture on autoimmune thyroid disease. And I show these pre and post antibody levels, which I'm sure you have too. And I particularly show my two children who were diagnosed with Hashimoto's disease at age 12. They were 12 and 13. And I show the progression as they decline on, this holistic regimen that I did for them. And they basically have no signs to maybe occasionally just slightly, elevated TPO antibodies, but basically they have no signs of Hashimoto's at this point.
I know I've heard you lecture before, and you feel quite a large body of the population does suffer from subclinical or really frank thyroid disease. Why do you think there's so much rampant thyroid disease today and so much autoimmune disease?
Well, the number one thing, there are many factors for this, but the main factor is iodine deficiency is just rampant in our epidemic in our population. And my testing and along with my partners has shown over 7,000 people, that 98% are low in iodine. The United States NHANES study has shown that iodine levels have fallen over 50% across the United States in the last 40 years. During that same time, and the iodine levels were low back then, and they've fallen over 50%. And during the same time that iodine levels have fallen over 50%, our exposure to toxic chemicals that directly and negatively impact the thyroid have skyrocketed, such as fluoride and bromide and chlorine derivatives. So we've been hit with a double whammy, where not only have our iodine levels fallen, our exposure to these toxic halides, which mess with iodine even more and mess with our thyroid even more, have gone up. So actually, over the last 40 years, our iodine requirements have increased because of this toxic exposure, and they've gone down. So I say that's the number one problem with it. And then,
what's the way that you test for iodine deficiency in your office, David?
So if someone's not taking iodine, they can do a spot urinary iodine test. And there are reference ranges for that. If they're taking iodine, which is
the lab that you use? Do you mind me asking?
I use Quest Labs.
Okay, thanks.
If they're already taking iodine, the spot urinary iodine test won't work because we don't have reference ranges for that. Therefore, the only test that's available is a 24-hour urine, and it's called an iodine loading test, where they take a known amount of iodine, collect 24 hours of urine, and you see how much spills out and how much is retained by the body.
Okay. So, so one of your treatments of dealing with the sub-laboratory thyroid diseases, Dr. Alan Gaby calls it, is by replacing iodine. And so how do you decide what dosage you should give, and how does that work? Is it more loading dose in the beginning and then you taper, or how do you do it?
Well, it's different for different people, but as a general rule, I would say most of my patients are on about 25 milligrams of a combination of iodine and iodide. And if they have thyroid disease or autoimmune thyroid disorder or thyroid cancer, or even now the iodine's not only just for the thyroid, it's for the maintaining the normal architecture of the thyroid, the breast, the ovaries, the uterus, the pancreas, the prostate. So if they have any disease of those tissues, they may need a little bit more. So through proper testing, and that's where you're really using that 24-hour loading test, you can get the doses right. But generally, if somebody can tolerate any milligram amount of iodine, they can tolerate hundreds of milligrams amounts of iodine without any problems.
What about
So,
those studies about it lowering TSH and that controversy over it?
so the question, the criticism I get for treating my autoimmune patients with iodine is that it causes or worsens autoimmune thyroid disease. Well, I can disprove that very quickly by telling you over the last 40 years, across the United States, iodine levels have fallen nearly 60%. During that same time, Hashimoto's and other autoimmune thyroid disease have skyrocketed epidemically. If iodine were the causative agent for these illnesses, that would not happen over the last 40 years. That's a negative association. Now, association doesn't equal causation, but a negative association disproves causation. Iodine does not cause Hashimoto's, it's iodine deficiency that causes it. And it's iodine treatment that fixes it for most people. Are there occasional people where I give iodine and they become hyperthyroid? The answer is yes. Between me and my partners, we've had maybe 5-6 people over 15 years of doing this. These are people with autonomously functioning nodules in their thyroid, where you give a little bit of iodine, they soak up the iodine, they start making too much thyroid hormone. You can pick it up in the first dose or two. It's very easy to pick up. And you just stop the iodine. Either they get the nodules out or they can't take iodine. Those are few and far between. For the vast majority of people, iodine helps. So to answer your question, there are studies that show that iodine increases, or most of the time it increases TSH. So they're saying it's causing iodine-induced hypothyroidism. Well, that's not true. And I explain this mechanism in my book on iodine, where the symporters that transfer iodine from the bloodstream into the glands require TSH to be made in the body. So in an iodine-deficient body, there's not going to be a lot of these taxicabs, symporters, to transport a lack of iodine into the thyroid and the breasts and the ovaries and the prostate and all those other tissues. As soon as you give someone iodine, first thing that happens is their TSH goes up because they're trying to make these symporters and these taxicabs to move the iodine into the cell. That's a normal and expected response. Unfortunately, researchers check a TSH level and they say it went up, therefore it's causing problems, and that's what you see in the literature. So I just don't find that. Either I have different patients than these guys, or I'm explaining it the way I see it. And I can tell you, I think my explanation is true.
So I deal a lot as a medical nutritionist with breast cancer patients. And there's the work of Eskin, who started out in the lab, in Petri dishes, in vitro studies, then in rodent studies, then in human studies, and then his research has been replicated, showing that iodine eradicates breast cancer cells in the breast, and it helps the lymph take the hormone out of the breast so you don't get bioaccumulation of hormones in that hormonal tissue. So in many of the studies, and there's like 30 of them at least, in the final conclusion, it says that iodine should be an adjunctive treatment for women who have breast cancer, and it works for negative, ER negative, ER positive, triple negative, etc. So does it do the same thing in all these other tissues that iodine is important for the architecture for, that you mentioned?
The answer is yes. And what you're saying is irritating me greatly, because we got 1 in 7 women with breast cancer across the United States. We have 1 in 3 men with prostate cancer. We have thyroid cancer. It's the fastest growing cancer in the United States. We have pancreatic, ovarian, uterine going at epidemic rates right now. And the American Cancer Society, the Komen Foundation, the rest of them, they're all frauds. They don't really care about finding an underlying cause of these illnesses. They just want to support more of the same cut, slash, and burn, and this medical industrial complex has been set up. So what you say is true, and what you say is, if what you say is true, then iodine deficiency could be sort of the leading cause of why we're seeing this epidemic of disrupted glandular architecture and eventually cancer. And it just irritates me to no regard that the studies that you quote from Eskin, some of them were started in the 1970s. So we're looking at 40 years of research.
I know, it's been so many decades. Nobody cares, and it's so inexpensive. It can't be patented. What I do now, I know that you give it orally, but when I have someone with breast cancer, I mix it with DMSO, and I have a protocol where I use it because that's a dimethyl sulfoxide is a biological driver, and it helps push it in all the way to the chest wall. So I'm not sure if just taking it orally, especially in really large breasted women, or if there's some circulation and tissue changes in these patients, I don't know if they're really getting exposure of the iodine to all the tissue. So I've been doing it orally, mixed together with topically. And I also use pomegranate oil because it downregulates estrogen receptor alpha and upregulates estrogen receptor beta. So in the morning, I have them do that. In the evening, I have them do the iodine and DMSO. But it's amazing. You first told me about iodine and breast cancer. I think we met at an environmental medicine meeting with Dr. Ray in Dallas many years ago. And I had been writing hormone deception, and I got up and asked a question, and they had just made it the pick of the month or something like that. And you and I started talking, and you told me about your work with some impressive cases of turning women around that they were told by their doctors to go home and put all their affairs together. And iodine was one of the main tools that you use. So I've been doing that ever since. You've been a big mentor to me on that.
So I do remember that meeting clearly. I was near the front on the right-hand side. You were on the middle to the back on the left-hand side.
God, you remember that. You have good iodine in your brain.
You got up and asked that question, and you announced your name, and I turned around with my mouth open, and you started staring at me, and you're probably wondering, what's this creep doing? And as soon as that session ended, I went right up to you and I said, I've been reading your books. And that hormone deception book was one of the best books I read. And can we talk? And, we hit it off right away, as we were old friends at that point.
We were like kindred spirits. And then I had an issue from all the things that I've been going through. And you ended up not only being a mishpucha or brother person to me, you ended up really helping me on my healing journey. So in so many ways, our lives have intertwined, and it's really, I got to hang out with you on that lake. But coming back to the iodine, can you talk about the favorite way you give the protocol for breast cancer, and does it differ at all for when the cancer is in the pancreas or in the ovary or in the uterus and the other organs that iodine rules?
I agree with you about putting it topically. If I have them do it topically too if they can feel the lesion. If they don't, I just have them do it orally. And if you give enough iodine, hopefully from the animal test tube and human studies, you can get the tissues to start taking it back up again. Now, the iodine's part of the protocol. I mean, people need to eat well. They need to detox. They need their nutrients corrected. I mean, it's not a standalone therapy for this, but I think when you look at the literature for iodine, it's such a basic thing for thyroid function, for breast function, for ovarian, uterine, and the rest of the glands, that it's just irritating to me that, conventional medicine doesn't even acknowledge it. And, I hear from my patients who go to these endocrinologists and they say, well, there's enough iodine in salt. Iodine deficiencies a thing of the past. It ain't a thing of the past. And just look at the NHANES study from the U.S. government. They'll tell you it's not a thing of the past.
And the worrisome thing is the sea salt hardly has any iodine in it. And I just had Barbara Demanu on my radio show, and she wrote a book called Toxic Cocktail. She's a scientist at the Sorbonne, and her whole career has been the thyroid and how hormone-altering chemicals are damaging it. And she was saying we're not getting enough iodine. And the people that use sea salt, it has even less iodine, so they need to be on iodine supplementation even more, and people don't realize that.
Absolutely. Absolutely true.
And you give salt to your hypertensive patients.
So that book you held up, Salt Your Way to Health, that book was written because I was finishing my first edition of the iodine book in the late 1990s. And I was near the end of the book. And then every Tuesday in the Detroit Free Press, there's a article from a health section. That wasn't really a health section. It was mostly on the newest drug or conventional surgery or something like that was out there. So there was an Ask the Nutritionist column. and she was a resident dietitian. And the question came in, is there any difference between regular table salt and sea salt? And she answered it, no, there's no difference. Therefore, they should both be avoided because they cause health problems. So I remember I cut that article out. I pasted it over my computer as I was finishing the iodine book, and I was irritated by it. And as soon as I finished the iodine book, I went and wrote that salt book because
Here's
I had been
salt
using
book, Salt Your Way to Health, just so you can see it here. One of the 13 books that Dr. Brownstein has authored in his prolific manner.
So I had been using salt in my practice for years, checking electrolyte levels and seeing. I called salt deficiency a sodium less than 141 milliequivalents per liter and a chloride less than 105. And what happens when you don't have enough salt? So we don't have any stores of salt in our body. We either get it in our daily environment or we become salt deficient. And salt is the second major substance next to water. We need salt for maintenance of fluids, for adrenal function, for hormone production, for everything. I mean, we can't live without it. So, I was taught in medical school, no salt's the best salt, and salt causes hypertension. When I finished my iodine book and I started researching the salt, because I noticed when I was using unrefined salt in my practice that people's blood pressure didn't go up, it went down. And I ascertained it was the minerals in the salt and the correction of the salt deficiency that could lower blood pressure. So when I started researching the salt equals hypertension hypothesis and how it came about, I came to the beginning of that, which was in the 1920s with some animal studies where they fed these animals enormous amounts of salt that you and I could never eat, ever. And their blood pressure went up a little bit. And then it was really perpetuated in the 1970s when a big study it was a worldwide study called Intersalt. And I described this in my book, but it was there were 35 areas of the world they studied salt intake and they looked at blood pressure. The only correlation they could make was two groups of people who ate very low salt had very low blood pressure. And the Surgeon General of the United States seized on that and said, see, salt causes hypertension. We need to lower our salt intake like these two groups. Well, the two groups were a Yanomamo tribe in Brazil and a non-acculturated tribe in somewhere around there as well. These were people that were tribal people. They didn't eat any white man's food. Their blood pressure didn't go up as they aged, and they ate a very low salt diet because they basically were hunter-gatherers. And the problem was, well, it's not a problem. I had studied the Yanomamo Indians at the University of Michigan, and I remembered my studies with the Yanomamo Indians. So their blood pressure didn't go up as they aged because they died about an average age of 50. They didn't live till old age. So it was just a whole misstatement and a myth that we needed to lower our salt. In the other 33 areas of the world that they looked at salt intake and blood pressure, they couldn't draw any conclusion because some cultures ate a lot of salt and they had low blood pressure, and the opposite occurred. You could predict a low salt diet will raise blood pressure because it triggers these adrenal hormones such as aldosterone and epinephrine and other things to increase and to help the body hold on to more sodium. And when that does that, it causes the blood vessels to constrict and the blood pressure goes up. The treatment for that is just correct the underlying problem, which was salt deficiency. And I see that in my practice on a daily basis.
The American Heart Association came out so strong against salt, and then they started noticing that it was worsening a number of sub-cohort populations, like people with congestive heart failure. So about a year ago, they retracted that sugar was the big deal. It wasn't really salt, but that didn't make headlines. And most people come in trying to eat a salt-free diet. Their cardiologist recommended it, but they're really not able to improve. It's the same way with fat, so forth.
Yep.
They take
good fats. As I always tell my patients, some of the worst people you can get dietary advice from are medical doctors, and just cardiologists included. I just wouldn't bother with them. These people have they have no biochemical training and diets, and they basically don't know what they're talking about. The only ones that know what they're talking about are the functional doctors out there.
I just had William Davis on my show, who had the bestseller in 2011 called Wheat Belly, and he just came out with a book in May. That's why he was on my show, called Undoctored, how the healthcare system has failed you and how to be smarter than your doctor. And he said that he was making money for his hospital with all these procedures with stents and interventions for his cardiac patients. And then he discovered if he took people off of bad carbs, refined sugar, he could, with nutraceuticals, take people who were going to be candidates for heart transplant and in about a month and a half start to reverse them. And so he had to quit medicine. He couldn't he couldn't hand out statins and give scripts for the procedures. And yet it was very interesting to hear his thoughts on where medicine is going to go. So because functional medicine doctors are seeing such rapid results, why is it that straight medicine stays stuck the way it does, whether it's dietarily or thyroid wise? Why does it stay stuck like it
Well,
does?
you know what? I'll go back to the 1800s and Dr. Semmelweis. And I believe he was in Hungary. And there were two hospitals in Hungary. And one was a public hospital, one was a private hospital. And what he worked at both hospitals. And when pregnant mothers went in to deliver babies at the public hospital, they died at an 8-fold rate higher than the private hospital. So he wondered, what's the difference? He's doing deliveries at both. Why are they dying here and not dying at this other hospital? So he ascertained at the public hospital, they were doing autopsies on people who died. And then after the autopsy, the doctors would come and deliver the babies. So he felt doctors were transferring something from the dead bodies to the pregnant mothers, and it was killing them. Now, that was before the germ theory was known. He didn't know about bacteria or viruses or anything like that. So he used a term for it, of transferring, I can't remember what he called it, but it wasn't bacteria. They just didn't know what it was. So he did a study where he put a bucket of water between the beds of the pregnant mothers in the public hospital, and they had doctors dip their hands in the water for 1 minute before they delivered the babies. And the maternal mortality rate now fell 8-fold lower after 30 days to what the private hospital was. So he wrote an article about it, and he said doctors need to wash their hands before delivering babies. For his radical ideas back then, they kicked him out of the hospitals, both hospitals. They wouldn't let him deliver any more babies. He supposedly was put in an insane asylum after that, and he died a short while after. It took 40 years for physicians to wash their hands before delivering babies and doing surgery, even though 40 years previously, Semmelweis had said it would save lives. So it goes to show that medicine is never easy to change. Doctors are not easy to change. Doctors don't want to admit they're wrong. And we're still stuck with that today. The doctors today have the same ego and the same I'm right mentality that the doctors in the 1800s had when Semmelweis ran into his problems.
So it's human nature to be down on what you're not up on. We know that. So one of the things I would love you to chat about is that you are one of the few physicians, Dr. Wright also, who's one of my mentors, who really takes a look to not only look at adrenal function, adrenal fatigue is kind of a buzzword, and the adrenals and the thyroid gland depend on each other, but you also really take a look at aldosterone levels, and you take a look to see if you need to give aldosterone replacement along with giving hydrocortisone replacement. So can you talk about that, please?
So the thyroid sits in the neck, and that produces a teaspoon of thyroid hormone for a whole year. And that thyroid hormone goes through the body and revs the metabolic rate of the body. Well, as the thyroid is telling the body, hey, pick up your metabolic rate, the other glands have to kick into gear and produce their hormones. And the adrenals are really important for this. They produce hormones like hydrocortisone and aldosterone and DHEA and pregnenolone and others that all regulate various metabolic factors of the body. And I always call it the thyroid adrenal teeter-totter. So when I'm with my patients, I take a little pen out and I tell them, we want the thyroid and adrenals in nice balance with one another. If you have your adrenals are tipped down and under functioning, and you give people more thyroid hormone, you're going to make this teeter-totter way out of balance, and people don't feel well. Conversely, if the adrenals are over functioning, the thyroid's down, people aren't going to feel well. So when I always counsel my healthcare practitioners, you got to be careful when putting someone on thyroid hormone if they have an adrenal problem, because you can make the adrenal problem worse if the adrenals can't kick up their production of hormones. Now, You can do the testing. There's testing for adrenal hormones because I do it in everybody. And you can check 24-hour urines. You can check saliva tests. You can check blood tests. And
but
if
it's only
someone,
the 24-hour urine that checks the aldosterone, right?
that is correct.
Okay.
So I do 24-hour urine to check for cortisol levels over 24 hours and aldosterone levels. And aldosterone is the hormone that causes the kidneys to hold on to sodium and release potassium. So in a salt deficient state, aldosterone levels should go up to get more sodium out of our diet, but you become potassium deficient in that case. The key for that is taking more salt. But if they're really low in their adrenal function, hypoadrenalism, adrenal stress, then sometimes what I'll do is hold the thyroid hormone, put them on the adrenal hormones, which can include aldosterone and hydrocortisone, as well as DHA and pregnenolone, and then wait a week and then start thyroid hormone. And it's, again, trying to keep that teeter-totter nice and balanced.
Now, sometimes people can't handle even a small amount of DHEA because DHEA really has receptors on the sebaceous glands, and people can get acne. And I know that you've discussed sometimes you need to go down to a 0.5 milligram or 1 milligram in those people, or give more pregnenolone and push it from that portal door. Can you discuss that a bit?
Well, that is a problem with DHEA. That's a very minor problem that I don't see in too many people, but it happens. So I always caution my patients, I usually use, my 3 DHEA doses are 2, 5, and 10 milligrams. And I just, if you look at over the counter and you go to health food stores and, some other people over the counter that sell supplements, they have 50 and 100 milligrams of DHEA. I don't use those doses. So in the 2, 5, and 10 milligrams, I generally don't see too many acne problems, but occasionally I do. At that point, I back their doses down. I agree with you. Pregnenolone is not a big a factor in that. I'll try a little bit more of that. But again, it's just trying to get that balance restored. And sometimes those are the people that need a little bit of hydrocortisone along with the DHEA. And I can tell you, anyone who's on hydrocortisone needs a little bit of DHEA because hydrocortisone will lower DHEA production.
I didn't know that. Okay, and why don't you talk a little bit about giving Florinef, which is the pharmaceutical aldosterone replacement. Jonathan Wright has that ongoing study. It's not a double-blind placebo-controlled study. It's an open-ended study, but he is using it in men for hearing loss, and he's had about a 30% benefit from different guys that use it, but that's pretty impressive on guys who normally would not have hearing. Have you done that? Uh-oh. I think I lost him. David? David? We had a little glitch here. Maybe he's going to call us back. So I guess I'm going to pause the recording. Pause recording. Zoom recording. Okay, welcome back. We had a little IT glitch. So somebody wanted to know, while you had a little IT glitch, what the optimal levels of, let's see, what did she say here?
Sodium and chloride.
Yeah.
So sodium 141 milli equivalents per liter or higher, and chloride 105, same units or higher.
Okay, someone else wanted to know, does Himalayan salt have iodine, and what about kelp every day?
So Himalayan salt has very little iodine, not enough to supply the body's needs for iodine. Kelp, the problem with kelp is our oceans are incredibly polluted. Kelp has the same sodium iodine symporter we have to concentrate iodine, and if there's bromide or fluoride or chlorine derivatives in the water, it will concentrate that in lieu of iodine. I've checked different kelp supplements for their iodine content. They don't match what's on the label, and different bottles have different amounts of iodine from the same company with the same label. So I would say if you're really going to prescribe iodine for someone, give them a known amount that is precise.
Okay, Karen said, great interview. Would love to know if the testing can still be done accurately if someone, this is the question. So if someone is on inhaled steroids, because without them, they can't breathe, they have such severe asthma, yet you feel like they have really hypoadrenal functioning, how can you test their adrenal function while they're on steroids?
All right, so we don't want inhaled steroids. No, everyone's using nose steroids and lung steroids now, and is it causing HPA axis suppression? You can do a 24-hour loading test. I'm sorry, you can do a 24-hour adrenal hydrocortisone output test to see.
So a
And
urine test.
you can do a urine test. You can also check ACTH levels, in the morning and look and see where they are. Now, what I find with a lot of people is they don't need to use full doses of nasal and oral inhaler steroids. They can usually use lesser amounts, particularly if they need it when they clean up their diets and correct
This
all those.
person is eating a really perfect diet and has to be on full force so she can't breathe. And,
I've got them
and,
too.
and this young girl has POTS disease. Are you aware
I
of
got 'em.
the epidemic now of POTS disease? Maybe you can even comment on that.
Well, I don't know what you're seeing. I'm seeing it too, and I would say vaccines are a number one cause of POTS disease and screwing up the adrenal.
This person didn't have vaccines.
It's what I put my POTS patients on are very large amounts of salt, and
Okay.
I get their other hormones in order. I have a lady; she gets her POTS symptoms if she drops below 6 teaspoons of salt. She just can't do it, and so she maintains about 8 or 9 teaspoons a day, which she doesn't like doing, but she does it, and she feels normal. And if she drops below 6, all her symptoms come back. Now, does it cure every POTS patient? No, but it helps almost every POTS patient.
That is so interesting. So this is a dystonia. There's a lot of different conditions. It's an independent risk factor to be a child today. And there's a lot of serious illnesses that are just on an epidemic rise on our young kids. And this is one of them. It's a dystonia, an issue with the autonomic nervous system. But vaccines could be an issue, bad food, but it could also be other things because our planet is ill. So our kids are ill because our amniotic fluid has been ill. And I've been writing books on this for a really long time. That was the first book that you really like. Let's see. My shake shows 990% of iodine with 1 teaspoon of kelp shake. Well, that's just the recommended daily allowance, which he is saying is not adequate. So that 999% doesn't mean anything. Another question is that Claudia is a family practice doc. There's a number of docs on here with us tonight, is asking if you test iodine, what's the functional acceptable range?
Well, remember, I said to you, you can only test it if they're a spot urinary iodine, if they're not taking iodine. According to World Health Organization numbers, and every really acceptable standards, they'll say 150 micrograms is the RDA for iodine, and really is the spot urinary iodine minimal, or the reference range is set for 150 micrograms. For pregnant women, it's a little bit more, 220. I say that's not enough in our toxic world today. Not enough for the thyroid, and not enough for the breast, not enough for the rest of the body. So the spot urinary iodines, if they're not taking iodine, everybody is low that we check. Not every, 98% are low. The only ones that aren't low are the ones who've read my book and are taking iodine coming into our practice. If they're already taking iodine, that's where the 24-hour loading test comes into play. And what we found is about 95% excretion. So out of a 50 milligram load, 45 milligrams coming out, or 90%, is about normal, and they hang on to about 5 milligrams. And that's sort of the pool in the body that moves around every day, the 5 milligram load. So people who are iodine deficient and they take 50 milligrams will hold on to more of that. Maybe they'll hold on to 25 milligrams or 30 milligrams, whatever it is. And when you do the test, you'll see the reference ranges and the, what we expect the normals are. But I would tell your listeners not to get so caught up in, testing and treating people. We found iodine very safe, very effective for almost all patients. There's very few patients that can't tolerate it.
I have a question
can't tolerate magnesium or vitamin C. It's everyone's a unique biochemical individual.
So since the last 20 years of my career has been really taking a look at how the outer environment is more toxic and sabotaging and assaulting our internal signaling systems, I think that the lymph is constantly under more challenge and demand to clear things out. And the lymph system depends on iodine, which most people don't realize, to really help clear out a lot of the toxicants that we're exposed to. Do you think that's part of the reason why we do need more iodine too? Does that make sense to you?
Of course it does. And that goes back to what I said earlier, where we've got this huge exposure to bromine, fluoride, chlorine derivatives. They're all over. They're in our houses, they're in our food, they're in our medicines. And when I was working with Dr. Abraham before he died, we were doing studies with checking people with bromide levels, and we were finding, the ones that were sicker, the ones with breast cancer, had twofold higher bromide levels than women without breast cancer. So
And
they
what are
need
all the sources of bromide? It's table salt, it's refined
so
flour,
it's in
colas.
it's in foods. Yeah, it's in soda. It's in sodas. It's brominated. It's in brominated vegetable oils. It's in brominated flour. It's in a lot of the bakery products, a lot of the breads, pasta, cereal. It's all over the place. And then you throw in where they use bromine as a fire retardant in furniture and carpeting and curtains and automobile. All inside of the automobile. We got a mess in our hands. And then toss in fluoridated water and fluoride in our medicines, and chlorine is another one that's all over the place. And all these things are in the halide family, and they can competitively inhibit iodine.
So do you have a filter in your shower and do you have a filter on your whole home, or how do you deal with that?
So we have we call him Tom Lee, the water guy. We are in our practice, we refer people to him. All he does is water filters. So in my house, I have a reverse osmosis filter under my sink, and I have a whole house filter to take down all that stuff. And that's what I tell my patients to do. And in our world, we need clean water and we need clean air. And unfortunately, we just don't have it.
I don't know if you're aware of this, but I started realizing there was a need for a whole house filter when I was first researching and writing hormone deception in the mid 1990s. So I got together with a water guy in Santa Fe, New Mexico when I was living there, and I asked him to design a whole house filter for my house, which was this big hacienda. I bought a dilapidated ranch and spent a year fixing it up. And then it was so successful. He kept coming back and checking my water, and we were learning this together, that he made his whole business whole house water filters. And that's how it started. It was really interesting, but it's so important. And we don't realize that we inhale more water in our home than we ever drink.
There's places in Europe, and I can't remember the city in France, where they've been using iodine to purify or ozone to purify their water for 100 years. And ozone doesn't leave the toxic chemicals like chlorine does. And we should be using ozone to purify our water, or we could use iodine to purify it. But instead, we allow chlorine and all the chlorinated compounds to end up in our public water supplies.
Okay, we have, so somebody asked, what is the best salt to eat? I stay away from conventional table salt because of the processing. What do you recommend?
So I generally recommend for my patients Selena's Celtic brand sea salt, Redmond's real salt, and Himalayan salt. I've had all three tested 4 different times. They've all tested clean. They all tested for good mineral content. Having said that, I think that Redmond's real salt and Selena's Celtic brand salt are cheaper than Himalayan salt. And I don't see any reason to pay the 30% more money that the Himalayan salt comes in. So that's what we do in our practice, and I encourage patients generally take about a teaspoon of salt a day and then go up from there, depending on their lab tests.
Another question, what about the Lugol's test where you put the liquid on your arm and see how long it takes for the color to go away?
I talk about that in my iodine book. That test is an inaccurate test. 20% of the body's iodine is in the skin. I don't know if that's what you're testing. There was one study that's found 80% of iodine rubbed onto the skin sublimates off into a gaseous phase. I don't know if that's what you're testing. It's not an accurate test for whole body iodine levels.
Okay, and what symptoms would we look for outside of a laboratory if a person has too much iodine?
If they're not hyperthyroid, okay, so you could get hyperthyroid if you have an autonomously functioning nodule, like I said before. Very rare. Those are the people that are going to go on iodine. They're going to get hyper symptoms right away, and they will recognize it, or you will recognize it, or they're going to go somewhere else because they're going to be miserable on it. That happens right away. That's not hard to figure out. Really, the only other side effect for iodine what comes to mind with me right now is occasionally some acne, and usually that's a detox reaction. And if they're getting acne from iodine and oily skin, what I do is I stop the iodine, work on some liver and lymph detox, and then try it again. And usually they can take it at that point. There are a few patients they get big acne breakouts with iodine, but again, those are just few and far between.
Are there really true iodine allergies? Some people say they're allergic to iodine.
So lots of people think they're allergic to iodine. A true allergy to inorganic, non-radioactive iodine, like what we're talking about, is very rare. Yes, it can happen. We do NAET in our practice for food and environmental allergies to try and clear them. Most people who say they're iodine allergic are not. They're maybe shellfish allergic, or they've had an allergy to iodine dye given in a nuclear test. And that's a different kind of iodine than we're talking about. So iodine allergy is very rare. Again, these are maybe a patient a year or less that you see something like this. I would say much less than a patient a year.
Okay, and how often are you writing scripts for aldosterone? Because when I talk about to patients here, I have to get somebody else to give them a script, or I'm consulting with someone in another town or country, and they have to speak with their practitioners there. The response that I get from requesting, even if I have a test that shows that they're low, is just really crazy. So how often is this an important tool in your practice?
I would say it's not that often. It's infrequent. The problem I found with aldosterone is it doesn't work on a lot of people, even when they're low. They don't. It's not really the linchpin that makes them feel better. Now I put them on it if they're low, but a lot of patients, in medicine, in medical school, we're taught diagnose a pathology, prescribe the drug to treat that pathology. It's a one-to-one ratio, one-to-one correlation. It's just not how it is in functional medicine, as you know. And so I will use aldosterone, although it's not my favorite thing to use, just because clinically people don't tell me, hey, I took that aldosterone, I feel better. That has happened, but that's infrequent. So frequently I find that getting everything else in line, such as detox and the hormone system balance and that thyroid adrenal axis sort of balance without aldosterone first, can help them, and then they don't need it. But I will prescribe it, and it's a safe hormone. I've never seen any problems with it at all. Mostly the reticence you're having is doctors don't know how to prescribe it, and they've never seen it before, and therefore they don't want to do it. And they weren't smart enough to check it like you were. So they're a little sheepish about prescribing it. But that's been my experience with it.
And can you talk, you've mentioned now a few times you'd clean up the liver, you do some detox. Do you mind sharing with us? Because I know these are your pearls that it took a long time for you to gather and get, but what are some of your favorite detoxes and favorite ways to, when you say clean up the liver first, how do you address that?
All right. So when in my first visit with patients, I always take a dietary history and, try and just sort of figure out where they're at. And one of my go-to lines with people is just cut out sugar and cut out sugar, cut out grains, anything with added sugar and anything with added grains, drink more water, and, add more salt to their diet. That's a standard thing that I'll talk to people about. But when I palpate their abdomen, you feel this little puffiness under the right costral margin. And, they got fatty liver probably, or if I don't check an ultrasound, or they're just puffy under there, and I can feel what I call liver congestion. So at that point, I tell them, look, you got to clean up your diet. You got to drink water. You got to cut out the crap, first, and then let's do a little liver. I talk to them about the liver being an oil filter, trying to keep the blood clear. And just as the oil filter in your car is supposed to keep the engine oil clear, our liver is supposed to filter out the impurities and get rid of them through our urine and our stool and keep our blood clear. Well, the liver in our environment is working way overtime, and it's hard, especially when they're eating lousy. So first step is clean up the diet. Next step is a little bit of, drinking water, adequate amounts of salt, and a little movement. And if they don't have any movement, they're going to have a hard time detoxing. And then in order to help the liver detox, there's two things that I'll usually go to. One is a powder called Total Liver Care that I developed with my partners. And
I didn't know about this. I'm glad to hear about it. Can we purchase this through you?
you can get it at my office, Center for
I didn't
Holistic
know
Medicine.
we were going to be giving another ad for you besides your books. Good for us.
I'll send you a jar of it if you send me your address.
Okay.
That took about 7 years to develop. And the first 3 years we were fooling around with different herbal combinations to see what worked. And the next 2 or 3 years we were working on the taste of it to try and get it right.
So it's a blend of herbs that helps the liver detox?
It's vitamins and herbs and minerals that we found that can really help improve phase 1 and phase 2 liver detox. And so I have people use this, and I also have almost everybody take alpha lipoic acid. And alpha lipoic acid is produced in the liver. But it's also, if you supplement it, you can get levels to go up in the body, and it really helps clean out heavy metals and toxins and helps the liver function better. And I find those two things, very useful for liver detox.
I'm giving a talk in about next week at A4M. It's their gut module, and I'm speaking on almost 5 hours with 4 gastroenterologists. And one of the talks is on fatty liver. So I had been writing that book, my gut book that you kindly wrote an intro that I haven't published yet. And I've been really looking at which foods have a lot of science behind them to help fatty liver. And one of the most powerful groups of foods are ones that are high in anthocyanins, blue. That's why I wore blue tonight, was because I was eating black rice today. If you make black rice, it has maybe 50 articles on it showing that the blue pigment in black rice eradicates breast cancer cells, reduces fatty liver, helps promote all the detox enzymes.
So it's the time of the year for blueberries in Michigan. They're nice and sour the way I like them. I get them at Costco, and I eat this whole pint of blueberries every morning before work. My wife went to Costco. I ever go twice a week for these organic blueberries. And so she had 5 in the cart today, and the lady at Costco said, "Wow, what are you doing? Are you making blueberry pie? What are you doing with these?" She goes, "No, these are for my husband. He eats one of these a day." And the lady was just astounded. And
well,
so
that's
I'm
one of the reasons you look
too.
so good, is you have all this pigment in your skin. The more colorful veggies you eat, they've done studies to show that you're more attractive. And one of the reasons is that the polyphenolic pigmented compounds go into your skin and make you look that way. You look like you eat a pint of blueberries a day.
Well, we're looking blue, both of us today.
So that's really, so what is the name of that product one more time?
It's called Total Liver Care, or TLC. And
I love it's TLC.
TLC, and it actually tastes pretty good. We have vanilla and berry, and I use a lot of that in my practice.
And what's the dosage on that?
It comes with a scooper, and I usually tell people a scoop once or twice a day till the can is gone. And for most people, I tell them, if they're not sick, maybe twice a year to go through a can of that. If they're sick, I'll have them do it for a while, sort of as a daily regimen, until I feel that puffiness in the liver go away and we get things on track.
Now, as practitioners, there's a lot of practitioners on the line, and people are going to see this. Can they purchase this from you, like in a case at a discount that they can resell to their patients?
We don't do a lot of that. I never told you about it. I don't know why I didn't tell you.
No, you never told me about it, David.
We do wholesale to practitioners who want to use it.
Okay, well, great. I'm really excited. That's one of the highlights of our chat tonight, that I learned that do you have any other products out that you've designed?
We've got a few products out.
You're not telling me about this, bro. What's going on here?
I forgot to tell you about. You never asked. I never told you. We've designed about. What happened was, this was years ago. We were using a very well-known product in the nutritional world, and I wasn't seeing the results I thought with my patients. So I paid, I don't remember, $300 or $400. I sent a sample of that to a lab for an analysis, and the test comes back where if it said 200, I don't remember how much, but if it said 200 milligrams of magnesium in it, and this was a detox powder, still in use today. You still see it on the market. Every conference I go to, it's there. And if it said 200 milligrams of magnesium, let's say when I tested it, there was 100. And, everything was off kilter, and it was always lower, instead of what was on the label. And there were small amounts of lead and one other metal, and I don't remember what it was. So I called the company and I said, "Look, I did this test on it. This is how it came out." And they had no interest. They didn't care. I called 3 times, tried to talk to somebody, left messages. Nobody returned my call. And I said to my partners, "Let's make our own." And we started working with our own at that time. I got mad about it. And I started testing other supplements out there. And what I found was, just because it says 200 milligrams of magnesium on the label does not make it so. And there's a lot of junk out there.
Yeah. Probiotics are totally like that too.
And a lot of fish oils, let me tell you.
Fish oils, they're terrible things in many of the
I tested some fish oils that had so much mercury in them, called the company. They don't care.
Are these doctor's lines? Are these doctor's lines that you tested?
Yes.
Oh boy. So, one of my very first patients when I started practice at the Center for Orthomolecular Medicine in Palo Alto was a young woman that brought in a baby that was about 11 months old, that looked like a mongoloid baby, that had very severe developmental delays. And all she was feeding when I did the intake on the baby was breast milk and spirulina, was giving it jars, baby bottles of spirulina. So I sent the spirulina out to doctors' data that I was one of the main lecturers that, during that period. I was teaching people hair analysis, mineral analysis. I was on the lecture circuit. And it came back that the lead was off the chart. So I did a little gentle detox, of course, gave the competitive minerals like calcium, etc. And within a very short period of time, the morphology of the face went from looking like a mongoloid child to looking like a normal child, and caught up with development. And I called up the company that the spirulina had been made by, and they didn't care at all. They didn't want to know anything about it, and they didn't want to work with me. And now you realize that these are our tools as functional docs.
So I always tell practitioners, you know what? Don't be so certain what's on the labels on the label. Use a good company. Ask them for analyses of their products. They should have an analysis of every batch that comes out. You know, when we started working with our products, I told, now I'm not there mixing the magnesium and the potassium and all this stuff together. I told the guy, I do not ever want to be called out that what that label says isn't in there. So we fudged everything 10% higher. 10 or 20% higher. And I said, if there's any abnormality, this is on you, not on me, because I'm not, you know, I've told you, we're never going to get caught with toxic substances. Or, I mean, look, if you have minerals, there are some, it's hard with a lot of the minerals to have pure, if it's coming from soil-based things, because the earth is so polluted. But a little bit's reasonable to me. I mean, but when you have a lot of it, which I've tested some things, I had a lady who was clay. She was taking some clay from some mountain somewhere in Hungary or somewhere in Europe. They said pure area, there's no heavy metals in it. So I test her hair, and I did a urine challenge metal test. Her lead and mercury and cadmium were off the chart, highest I've ever seen. This is a lady who ate a pure vegan diet. She's been following holistic principles for years, exercises, feels crappy, and is doing this clay and selling this clay as a distributor. So I asked her for a sample of clay. I sent it in, found exactly what was in her in that clay. Called the company. They don't care. Still out on the market. I still see it out there on the shelves today. Now I tell people, and I haven't tested everybody's clay, but I tell people I would never ingest clay. Clay absorbs things from the world. Our world's so polluted right now. I just don't know. And after having that experience with that one patient, I would never ingest clay.
Boy, you know, I was staying as the very first house guest when Jonathan Wright, one of my mentors, and obviously one of yours and now colleague,
Yep.
he built a house. You live on a lake. He lives on a lake. I have to be next. Why aren't I next? He lives on 7.5 Mile Lake, and I was their first house guest that they invited. And they were telling me the story that for a little bit, his wife wasn't feeling that great, and she'd been taking a lot of turmeric, because a lot of the roots gather a lot more of heavy metals that are in the soil, and turmeric is a root. And he didn't realize this, in his dispensary purchasing turmeric, but that turmeric was from India, and it was very high in lead, and her lead levels went off the charts. So you have to only get your turmeric from companies that give you monthly analysis and have accountability to show you that there aren't heavy metals in them.
And I would add to that, I don't use a supplement or an ingredient from India or China right now. I wouldn't use it. I've tested so many Indian, Ayurvedic products. I've maybe a dozen of them, all high in lead and mercury and cadmium and other metals. Every one of them.
I won't even use a coffee cup that's made from China.
No,
because you're putting hot water. Yeah.
The Chinese herbal products I've tested, maybe a half a dozen of those, all of them through the roof with heavy metals. I just wouldn't do it. I mean, it's just not worth it.
Heavy metals are immunosuppressive. There's no healthy level for heavy metals, and heavy metals in children rob IQ points. There was a book called The Bell Curve. I talk about it in Hormone Deception. All you have to be is exposed to a little bit of hormone altering chemicals or heavy metal altering chemicals, and your IQ in your child goes down.
So we've tested thousands of patients for heavy metals. I would estimate 85% of patients toxic in lead, and well over about the same amount toxic in mercury. It's prevalent out there. It's what's going on. The sicker the patients are, usually the higher those levels are. We have a big mess on our hands.
Okay, we have a few questions here. Let me see that people have been writing some questions as we've been talking. What dose do you use for aldosterone when you do use aldosterone replacement, David?
So they come in 0.1 milligram tablets. What I'll start people at, if they're really sensitive people, I'll start them at a half a tablet a day for about a week, and then try and have them go up to the full dose, 0.1. Very rarely I've had to use 0.15. And again, with aldosterone, clinically, I don't see any negative effects with it. I just didn't see too many positive effects with it
Well,
either.
I only have one adrenal gland, and you helped me. I was getting some issues. I do a lot of working out at the gym and a lot of canoeing, and I was starting to get these bilateral muscular weakness
Yeah.
symptoms that didn't make any sense. And we tested my aldosterone. You gave me that dosage, and all I needed was to be on it for about a month, month and a half, and then that basically improved it for a long, long time. So sometimes it seems like you just need a rebooter of it. Does that seem right to
Totally,
you?
totally true. I've seen that. I've seen that play out a few times. Absolutely.
Okay, the question is, how have you seen people getting any benefits to splitting thyroid meds to one half in the morning and one half at night instead of all in the morning?
I tell my patients, I usually tell my patients, take it in the morning. I have maybe 5 or 10% of patients who between splitting the dose or take it at night feel better that way. So if they're not feeling well in the morning or they're having some problems, I tell them, hey, first thing I say is split the dose. Next thing I say is try it at bedtime. And there are, I would say, the vast majority do fine with it in the morning. And I found a lot more of uh, having to split the dose with patients before I started using iodine. Once I started using iodine, it didn't seem to quite matter as much. But I still have some patients who I do split the dose or take it at night. And I
Do you
just,
make your own iodine product, or do you have a favorite company you like?
I use RLC's, Nature Thyroid, and West Thyroid Pure. I find those work, especially that West Thyroid Pure works in very sensitive people.
No, I mean the
Um,
iodine.
oh,
Iodine.
the iodine. No, we don't make our own iodine. I use Lugol solution, as it was made in the 1800s, 5% Lugol solution, and I use tableted Lugol solution in the form of Lugol tabs from Hakala Labs or Ioderol from Optimox.
Okay.
And
And
I also use Biotics as Iodozyme HP. I've had all those products tested. They all test fine for iodine.
okay, who do you have test all these products?
Well, there's a lab. What's the guy's name? I used to test the iodine products myself. I had a lab set up in my office, so I had the whole Michigas available to me, and um, I quickly realized I didn't like to be in a lab. And once I started testing it, I found these products work and they're fine. I stopped doing that iodine testing. But I send supplements out for testing. I used to use King James. They stopped. They went out of business. So now I use Doctor's Data, and there's a lab out in like Kansas, or I can't think of the lab name, but they'll test supplements for a couple $100.
Okay, and I'm going to want to, before we finish, I'm going to want to know all the different products that you have. And we can chat about that. I designed Metagenics' first Femline, and I designed the first natural menopause product in the United States. And I formulated about 10, 11 lines. Leo Gallen and I designed a line at one point. We used to hang out together. Him and his wife were really cool. And I'm really kind of hunkering to do some of my own products, especially for women who are on hormones, because there's so much else to do other than DIM. But we'd love to hear that. But let me just get to, someone asks, have you heard of Terramin Clay? Terra, no, he hasn't.
I don't.
Diane asks, when one is on thyroid and is going to have repeat blood tests, do they take that thyroid in the morning or do they skip it? That's a
Good.
great question, Diane.
That's a good question. All right. So thyroid T4 has a half-life of about 7 days. T3 has a half-life of a few hours. So if they're on like desiccated thyroid with a little T3 in it, my suggestion is don't have them take it in the morning. So I've just kind of made a rule with myself over the last 25 years. I don't want people to take it in the morning because I don't know what their absorption rate is of it. And what if I catch a peak absorption and I'm sort of adjusting their daily dose based on I caught this peak absorption after they took it. So I have found from what I write about in my thyroid and iodine books that I just find a better stable results with not having them take it in the morning. That has worked for me and I just kind of continue doing it.
That's really helpful because that is really a tweaky concept, which is the best way. So that's good to know because you are the hormone doctor. Here's another question. I've heard that about 15% of all the population is salt sensitive. So the majority of the population should eat more salt. Does that sound correct?
Okay, so salt-sensitive people, I would say, are the ones who take salt, they get bloated, their blood pressure can go up. It ain't 15%. It's less than 1%, way less than 1%. Those are, I don't know, a patient every year, maybe less than that. I mean, these are the far outliers. I don't see that as the case. I see salt deficient people, and that's the vast majority of them. And the vast majority do fine with adding about a teaspoon of unrefined salt in a day.
Okay. Martha asked, do you do your thyroid RxSL for improved absorption?
I don't know what that means.
What does that mean, Martha? Does that mean slow
Oh,
release? I think that
slow
means,
release T3. Is that what she's asking?
I don't know. Can you clarify what you're asking, Martha? Sublingually.
Um, I once in a blue moon, if something's not working, I'll have them try it. I haven't done that in a long, long time. I don't. Dr. Barnes used to. He talked about that a little bit. Some people absorbed it better sublingually, the desiccated thyroid. Um, I just haven't done a lot of that. It's been years since I've actually told someone to do that.
I can't take any of the natural thyroids. I have hives every time I do any of the natural thyroids.
Did you try the Westroid Pure?
No, I haven't. I don't know if I've tried that. I'm going to have you
So
write a script for me for that.
I'll do that. I had a lady who was sensitive to every thyroid she took. Her TSH is like 80 to 100. She looks hypothyroid. She's all puffy in the face. She's achy and tired and can't walk anywhere. And she looks like one of those pictures out of a textbook. And we tried T4, we tried T3, we tried everything. Nothing worked. Everything made her worse. And then this Westroid Pure comes out, which is a little less preservatives in the thyroid, a more pure form of thyroid. And I actually tried her with compounded desiccated thyroid without, from a compounding pharmacist. That didn't work for her. Only this Westroid Pure was the thing she was able to take. Since putting it on her, and all of her puffiness went away, and she feels much better. I've had probably a half a dozen patients over maybe the last 5-6 years that have been in her position where they couldn't take any other thyroid except that version of it.
That's interesting. And they can get that at a regular compounding pharmacy?
You can get it at a regular pharmacy. It's
A regular
RLC
pharmacy?
Labs,
Okay.
and
She wants you to spell that. Spell the Westroid.
West WEST Throid THROID Pure. They call it WP Thyroid.
I think I
RLC.
have tried that one now that I'm thinking about it, but I'm going to try it again. I'm going to try it again because now that I see what's in all these other things, it's just shocking what, between my hormones, between my supplements, if you get all these things compounded, it's easy to start paying for myself. I'm on like 11 hormones, like $1,000 a month to be on things. So you kind of inch over to get some of the things from a regular commercial product. And then it's got so many additives that are questionable. You don't want to take those on a daily basis. Here's another question.
Absolutely.
If you have no specific symptoms, could you still be deficient in iodine?
Sure. I mean, look, do you have skin? Do you have breasts? Do you have liver? Do you have eyeballs? Of course. The human body can adapt to harsh environments. I mean, um, what we do to people. I mean, different areas of the world, and sure, you can adapt to. The human body can adapt very well to low iodine. It's done that for generations. It might be sick, but it can adapt to it.
Okay. Would he please say more about the healing protocol he used to help his children with Hashimoto's?
So, actually, my wife made the diagnosis. We were at dinner one night, and she said to me,
I got to meet your wife, by the way.
She said to me, "Do you think the kids have a thyroid problem?" And I look up, and all day I'm diagnosing thyroid problems, seeing patients with hormone. I can't see it at home with my kids. My kids were complaining of headaches. They were 12 and 13 or 11 and 12 or something. And they were complaining of headaches every day. They were tired. They were playing sports and acting like kids. And, I just kind of thought they were complainer kids. And my wife has a thyroid problem. I've got a thyroid problem. My mother has a thyroid problem. My sisters have thyroid problems. So she says that to me, and I remember at dinner, I sort of hit my forehead like, oh, yeah. So I bring them in, I check their blood work. They both have Hashimoto's. They're both gluten sensitive. They both have gliadin antibodies. They both have casein antibodies. They had a couple of nutritional deficits. That wasn't that bad. But I basically put them on a gluten-free diet, which I do for most Hashimoto's, whether they have antibodies or not. I put them on a dairy-free diet, which I found over 80% of patients have antibodies, IgG antibodies to casein. I checked their spot iodine levels, which
Oh,
were
which is the IgG test that you use?
casein.
No, I mean, which company do you go with for your IgG food allergy testing?
Quest.
Quest, okay. You use
Um,
Quest for almost everything, right?
I use Quest for basic labs, and then I'll use
Okay.
specialty labs for other things.
Okay.
So I put my kids on iodine. They were 11 and 12 or whatever age. I probably put them on 25 milligrams each. I put them on thyroid hormone at the same time. Put them on a little bit of magnesium for little bit low magnesium levels, and vitamin C, and really that was it. I cleaned up their diet, and both my kids, when you look at and I lecture about them and I show the pre and post lab tests, you'll see the antibody levels, which were in the couple hundreds, gradually just come down over the next probably 4 to 5 years. And one daughter followed her gluten-free diet better than the other one. Her levels came down much faster than the other one. And it really wasn't until the other one got on board in college that her levels came down fully.
Interesting. It's so fascinating because you and I had a podcast about a month ago where we talked about how so many patients are on too many supplements. And they go to a lot of these functional docs and they're coming in. I have so many patients coming in that are on 3 pages, single spaced, of 60 to 70 supplements, and they're not doing well. And they're afraid to go off anything. And what you just said was that you addressed effectively Hashimoto's in your daughters with really a minimalistic functional medicine approach. Can you comment on that?
Yeah, no, I saw a lady today. She's on so many supplements. So I go over, she's 82 years old. She looks like she's maybe 60. She feels tired and achy, and her brain's tired. She doesn't feel good. And we go over her labs, and I said to her, "You've got the labs of a healthy 30-year-old. There's not a 30-year-old person out there that wouldn't want your labs. Why do I feel so bad?" And she starts fetching again. And I said to her, "You're on too many supplements." Now, I've had this discussion with her before, and she doesn't want to stop taking her supplements. So she looks at me and I said, "Look, you're not getting better until you get rid of these supplements. I've done this with other patients. You're on too many things." So I told her, "You make a list of everything you're taking," because she won't even bring me on a list anymore. She doesn't want me to cut them out. I said, "You make a list. You give it to my nurse, Janice. Janice will go over it with me. I will mark off what I want you to take and what I don't want you to take. And then it'll take you about 6 weeks to get this antioxidant overload out of you." And I said, "I think you'll feel better." I said, "But until you do that, you're just going to keep feeling the way you feel."
So people don't realize that you need a balance between pro-oxidant activity and antioxidant activity. And most people are taking huge amounts of antioxidant activity, and they have antioxidant activity overload.
Absolutely.
And you can feel really badly from taking too many supplements.
Feel the same way as you can with oxidant overload. Absolutely.
Yeah. Someone asked, what was the recommended dosage of vitamin C for that Hashimoto's protocol for your daughters?
They were kids at that point. My recommended doses of vitamin C is just not to give them diarrhea. But I don't remember exactly what I put them on, but I probably put them on 1,000 milligrams a day each. That's what I would guess. And what I use now for most adults is a buffered vitamin C powder, and I have them use a scoop twice a day, which comes to about it's probably 4,000 milligrams per scoop, about 8,000 milligrams a day. And I tell them if they get the runs, just to lower it down. I would say a couple thousand milligrams. It takes I saw a study once. It took 2,000 to 3,000 milligrams to saturate the red and white blood cells with ascorbic acid. So I assume that's a minimum dose for people.
So what
Lindsey,
are the other products?
How about a couple more questions? And
we're gonna wind this up here. Mainly what we want to know is, what are the other products that you make, David?
We make about 15 products. You're going to put me on the spot here.
Oh, I'm sorry. No, I'm so enthralled by the idea that you have some products that I really want to get my hands on.
So we make some B vitamin combinations. Oh, we make a glute control to what I think it does is detoxify the insulin receptors, because we've had people come off type 2 diabetic medications, and a couple of patients come off insulin with a combination of iodine and this glute control.
It's called glute control?
We titled it glute control. It's got cinnamon. It's got, oh my goodness, it's late for me. It's got a bunch of herbal things in there and some vitamins and minerals, geared towards those.
I don't want to put you on the spot at all with this because I know it's late. You've already given us an hour and a half of your time. You've answered all the questions. You've been really great. I don't want to put you on the spot. If you want to, if you want to send me a list of some of the things you have, I'd love to try some of your products and see if I really know that you check everything and you do everything really smart. So
I'll have my office manager, Ann, get in touch with you tomorrow with that list.
Okay, and when you do that, then I'll make the list. I'll put it in we have a private Facebook group, and I'll put that list in so everyone else can know about it. Okay?
Sounds good.
It was so wonderful having you on. I know everyone here has been really excited. The chat has been really dynamic, and I get to hang out with my dear friend a little bit more and be reminded that you live on this gorgeous lake.
And hopefully I'll see you soon on it.
Okay, thank you so much, David. Bless
Take care.
you.
Bye, guys.
Bye-bye. Bye, everybody.